now the data are most promising for ibrutinib, which is a covalent BTK inhibitor, which has a 70% response rate. And at ASH, in treatment-naive patients, was reported to have over 90% progression-free survival at over 2 years and 75% progression-free survival at over 2 years in relapse patients. Then idelalisib is an inhibitor of the delta isoform of PI3 kinase. Also has a very high response rate in relapse refractory CLL, and progression-free survival is about 16 months in the phase 1 study. They haven't done a large phase 2 study in CLL yet. Those two are sort of leading the pack. There are other inhibitors of BTK and PI3 kinase that are behind them in development that we don't know yet exactly how well they compare to those. And then some of the other targets, dasatinib and everolimus, are drugs that are out there for other diseases, have been tested in CLL. Not that impressive as single agents, especially when you compare them to ibrutinib or idelalisib. SYK inhibitors, fostamatinib, 11 or 12 patients have been published, but the data were not really presented in the way we typically think about it for CLL, so it's a little hard to tell what happened with those patients. But companies are actively developing other SYK inhibitors that will likely go into the clinic, but again, those are behind, so we don't know how they compare yet.